Have you ever walked into a room full of new faces, only to feel your heart pound, your palms sweat, and a sudden, overwhelming urge to disappear? Perhaps your mind goes blank, or you start to tremble, convinced that everyone is watching, judging your every move. It's a feeling that can stop you in your tracks, turning what should be a simple social interaction into a moment of intense panic. For many, this isn't just shyness. It's a profound, often debilitating experience known as social anxiety, which can manifest as full-blown anxiety attacks when meeting new people. These moments aren't just uncomfortable. They can significantly impact our lives, from career opportunities to personal relationships. But here's the crucial truth. You don't have to navigate this alone, and it is absolutely manageable. Today, we're going to explore what causes these intense reactions, understand their symptoms, and most importantly, equip you with a practical, step-by-step plan to regain control and confidently engage with new people. We'll break down this complex topic into simple, actionable strategies, ensuring you feel empowered to step forward. Let's begin by demystifying what's happening. When we talk about anxiety attacks in social settings, particularly when meeting new individuals, we are often looking at a manifestation of social anxiety disorder, or SAD. This isn't just about being a little introverted or feeling shy. It's an intense, persistent fear of social situations where you might be scrutinized, judged, or embarrassed. This fear can be so overwhelming that it lasts for at least 6 months, often starting in childhood or adolescence, and it truly impedes daily life. Imagine weeks of worrying about an upcoming social event or actively avoiding gatherings altogether because the thought alone is too much to bear. So, what does this intense fear actually feel like? The symptoms can be quite diverse. Physically, you might experience blushing, excessive sweating, trembling hands or voice, a rapid heart rate that feels like it's leaping out of your chest, or an upset stomach. Your mind might go completely blank, leaving you speechless, or your posture might become rigid, your voice barely a whisper. In the most intense moments, these can escalate into a full-blown panic attack, complete with chest pain, dizziness, and a feeling of impending doom. Emotionally and cognitively, the experience is just as distressing. There's an intense fear of judgment, humiliation, or rejection. You become hyper-aware of yourself, deeply self-conscious, and terrified that your anxiety will be noticed by others. Your mind races, anticipating the worst possible outcomes, and afterwards you might spend hours, even days, overanalyzing past interactions, replaying every word and gesture. Behaviorally, this intense fear often leads to avoidance. You might find yourself turning down invitations, avoiding eye contact, or struggling to initiate or maintain conversations. Simple acts like eating or drinking in front of others, dating, or even job interviews can feel monumental, leading you to steer clear of situations where you might encounter new people. The exact causes of SAD aren't fully understood, but research suggests it's a complex interplay of factors. There can be a genetic component, meaning it might run in families. Specific regions of the brain related to fear processing also seem to play a role. Environmental factors, chronic stress, and particularly past humiliating or negative social experiences can significantly contribute to its development. A diagnosis is made when this strong fear and anxiety about social situations persist for at least 6 months and clearly impair your daily functioning in your work, school, or relationships. It's a critical distinction. This isn't simply choosing to be quiet. It's an involuntary, intense reaction. Now that we understand the landscape, let's turn our attention to the practical toolkit for managing and overcoming these challenges. The good news is that social anxiety disorder is highly treatable, and there are many effective strategies available. At the forefront of treatment is psychotherapy, with cognitive behavioral therapy, or CBT, often considered the gold standard. CBT helps you identify and challenge those negative thought patterns that fuel your anxiety. You learn to reframe catastrophic predictions, develop healthier coping strategies, and gradually build essential social skills. A key component of CBT is exposure therapy, which involves slowly and systematically confronting your feared situations. Think of it like building an anxiety ladder, starting with the least intimidating scenario and gradually working your way up. For example, you might start by simply making eye contact with a stranger, then progress to a brief greeting, then a short conversation, and eventually joining a small group of new people. Another effective therapy is acceptance and commitment therapy, or ACT. ACT teaches you to acknowledge and accept anxious thoughts and feelings without letting them control your actions. Instead, it guides you to commit to value-driven behaviors, helping you move towards the kind of life you want to live, even with anxiety present. Medication can also play a vital role, often in combination with therapy. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are common first-line treatments, helping to regulate mood and anxiety. For managing specific physical symptoms in performance situations, like public speaking or a job interview, beta blockers might be prescribed. Anti-anxiety medications like benzodiazepines offer rapid relief but are generally recommended for short-term use due to their potential for habit formation. It's crucial to discuss these options with a healthcare professional to find the right approach for you. Beyond formal therapy, support groups offer an invaluable resource. They provide a safe, non-judgmental space where you can share your experiences, gain perspective, and learn coping strategies from peers who truly understand what you're going through. Knowing you're not alone can be incredibly empowering. There are also powerful self-help strategies you can integrate into your daily life. First, practice cognitive restructuring. When a negative thought about meeting someone new pops up, pause and question it. Is it truly factual, or is your anxiety playing tricks? Try to reframe it. Second, shift your focus. Instead of intensely self-evaluating your own performance, direct your attention outward, towards the other person and the conversation itself. This reduces self-consciousness. Third, incorporate relaxation techniques like deep breathing and mindfulness into your routine. These can calm your nervous system before and during social interactions. Fourth, embrace gradual exposure. Start small. Perhaps practice striking up a brief conversation with a cashier, then move to a colleague you don't know well, before tackling a larger social gathering. Fifth, prepare yourself. Think of a few open-ended conversation starters beforehand. Having a mental script can reduce the feeling of your mind going blank. Sixth, build social confidence incrementally by practicing small positive behaviors, like making eye contact and offering a genuine smile. Finally, cultivate healthy habits. Prioritize good sleep, regular exercise, a balanced diet, and nurture your existing social support network. And importantly, acknowledge and accept your feelings. Labeling anxiety for what it is can take away some of its power.
As we consider moving forward, it's also important to acknowledge some of the ongoing conversations and challenges surrounding social anxiety. One debate revolves around whether SAD is under-recognized and undertreated, with many suffering in silence for years, or potentially overdiagnosed, pathologizing normal shyness. The truth likely lies in the middle. It's a real and debilitating condition for many, yet it's important not to medicalize every instance of social discomfort. Another point of discussion is the optimal treatment modality. Is pharmacotherapy, psychotherapy, or a combination most effective? Generally, an integrated approach, combining medication with therapy, yields the best and most sustainable results. There are also significant barriers to treatment, including lack of awareness, the pervasive stigma around mental health, and the very avoidance behaviors characteristic of SAD that prevent people from seeking help. This highlights why it's so important to talk openly about these issues. The role and risks of medication, especially benzodiazepines, are also debated due to concerns about long-term use and habit formation. Medications are powerful tools, but they should be used judiciously and under professional guidance, ideally as part of a broader therapeutic plan. Crucially, there's a vital distinction between simply facing your fears and structured exposure therapy. Unplanned, unsupported confrontation can sometimes be counterproductive or even re-traumatizing. Effective exposure is always gradual, carefully planned, and often guided by a therapist. Finally, it's worth noting that social anxiety frequently co-occurs with other conditions, like depression, generalized anxiety disorder, or ADHD. This comorbidity adds complexity to diagnosis and necessitates a comprehensive, integrated treatment approach that addresses all aspects of an individual's mental well-being. Looking ahead, the future of managing social anxiety is bright. There's a continued push to improve early diagnosis, refine and integrate treatment approaches, and overcome existing barriers to accessing care. Efforts are ongoing to combat stigma, develop more personalized interventions, and create comprehensive plans that address the multifaceted challenges of mental health. So, if you've been experiencing anxiety attacks when meeting new people, please know this. You are not alone, and it is absolutely within your power to change your experience.
Social anxiety disorder is a treatable condition, and with the right understanding, strategies, and support, you can move from a place of dread and avoidance to one of connection and confidence. Start small, be patient with yourself, and remember that every step, no matter how tiny, is progress. Reaching out to a mental health professional, a therapist, a psychiatrist, is a sign of strength, not weakness, and it's the most effective way to build a personalized plan that works for you. Take that first step today and begin to reclaim your social life.